post them in the text box, and we'll try and pick them up. We'll do that after the event if we don't have time to do that today. But I'd like to move on to introduce Kate Hilton. We're delighted to have her with us. You'll know Kate Hilton's work, her Psychology of Change paper that's been so influential. We forwarded it prior to this event, so everyone should have a copy of it. So yes, we're very grateful, I think, for Kate's role in really introducing quite psychological thinking to the world of improvement in such an influential way, and it feels as if we're all kind of benefiting from the fruits of that really in this work. So Kate, over to you, and we're hoping we might have time for some questions after your session. If there are a couple of questions or feedback or comments, I'm happy to try and take those after Kate's presentation.
Thank you so much, Benna. Really want to thank you and Matt and Sam and Rachel and Anna and everyone who's been so core to putting this all together. Thank you for all the work that has gone into that. And certainly thanks to all of you for your interest and your expertise in this domain. It's absolutely thrilling to be here with you and to know that I feel very much like the beginner in this group, surrounded by the experts. So I'm really excited to learn with you and from you the depth of your knowledge over your careers and the work that you've done, and or for those of you who feel like me in the beginner's mindset, you know, I welcome you as well. I wanted to just also acknowledge how amazing the design of the project is, and how it's so focused on sharing and collaboration and open and transparent. And I have to tell you, from a co-production standpoint, it's highly intrinsically motivational to me. So thank you for the thoughtfulness that's gone into the design. I'm going to share with you a little bit about the framework, which of course you can read in the white paper, but I do want to start by locating us in this moment, because I think it's worth addressing. So I just want to invite everyone, if you could, before I get too deeply into the wonkiness, to reflect on a couple changes you've been experiencing. I suspect we have them in common. I'll put that in the chat. All right, thanks for those that are coming in. I appreciate it. Ooh, Laura, I like yours slowing down. Amazing. I feel like my life is really sped up. I wanted to share with you a little bit about the changes in our world here in New Hampshire. These are my kids who are homeschooling. So we have, my husband and I both fortunately continue to work and now have an additional job, like most of you, I suspect. And I want to especially welcome Eloise to this call. I'm so excited that you're here with us. And also, we're fortunate to live in a rural area, so we are able to, by design of the environment, socially distance. And we realize that is not a luxury everyone across the world has right now. And so you can see my husband and I on a social distance walk with our neighbors and some other neighbors whose husband in the right corner is an emergency room doc who has moved out of his home in order to avoid any exposure to his kids, and visits them and stays pretty separate from them. So I imagine all of you are experiencing quite the same in terms of the changes in your life and the way that has affected your psychology and how you have met those changes. So we're going to reflect a little bit about that since this is one of those moments. I'm not sure it's going to be easy to replicate. I hope we never have to, where we're globally and collectively going through the psychology of change, or as you call it, the psychology of improvement, and we're doing our best to follow some changes around staying 6 feet apart and not exposing ourselves to COVID and to having to shop differently, having to disinfect things, having to work differently, having to support the front lines. And if you're on the front lines, our gratitude to you for the work that you and your colleagues do. And then of course, you know, having to manage the sort of the anxiety that's provoked by change and also by such dangerous change. And what I wanted to note is, you know, for example, social distancing, that's a technical fix, right? That's something that, you know, is pretty clear and we can quickly put that into place. But it has required from all of us as stakeholders some learning about what it takes to do that in our day-to-day. And we have experimented through our own PDSAs around what that looks like for each of us, for our families, or our shopping, or our working from home, or our homeschooling, whatever it is that you have now taken on that is new. And that is a lot of load to manage. Of course, we can apply this to improvement in terms of the changes that are evidence-based that we invite folks to take forward. This is my colleague, Dr. Michael Rose in South Carolina. He was implementing the surgical safety checklist in 2009 and 10 and ran into you know, the chasm, so to speak, of the human side of change and not being able to overcome that because of people's resistance to changing behavior until he put into place psychology of change methods and practices. And so part of the work of improvement is to learn those skills and to acknowledge the leadership that's required to encounter people's psychology and to navigate through that. So I just wanted to, we talked about the change we're experiencing in our own lives right now, but now I want to invite you to reflect on some of the barriers that you or your colleagues face when you're doing improvement work. What types of things are coming up in your work? If you wouldn't mind just chatting in. How do you see the manifestation of these forms of resistance? Great, these are familiar, and I think we're seeing each other in our responses here. I'll list a few more on this slide. These are by no means exhaustive, but there are a lot of things that happen that we can see when people are resisting change. And underneath it, some of you are noting the emotional experience that is driving the manifestation of these behaviors. And they're all legitimate, you know, they truly are. I'm going to sort of fly through this because I want to get to the framework, but I do want to ground us in why this matters and the importance of this work. Obviously, in an improvement context, it matters because we do have the evidence around how to make care better for people, how to improve people's lives, how to improve staff satisfaction, how to lower costs. We know how to do this, and we have patients, this is my son when he had broken his arm, who sometimes are our own. And our neighbors and our people that we care for and love deeply. And one of the great motivators in our work, whether that's today or every day, is love. It matters because we love people, and through the calling to heal, we care for people. This is Doris Lessing, a Nobel laureate from your side of the pond, and and she said that in the prisons we choose to live inside. Oh, I always blow it when I come to this quote, but she says something to the extent of, we know more about ourselves today than we ever did in the past, but very little of this knowledge has been put into use. We know more about ourselves today, but very little of this knowledge has been put into use. And it's this amazing recognition of injustice. It's an injustice between what we know and what we do. And we are in a knowledge economy. Boy, do we produce knowledge quickly, right? The papers that we and our colleagues write about change and improvement and evidence and what the next great thing is, we're so good at innovating. But implementing is a whole nother story. And doing that at scale is very different. And this gap, I call this the justice, that line on the far right, I called it the justice line. And that's what we're addressing in this work for the Psychology for Improvement, is we are trying to shorten that gap. And it's really hard because evidence is being produced at such a rapid pace. And we're experiencing so many other changes around us all the time to try to close that gap. This Institute for Healthcare Improvement, many of you may be familiar with its model for improvement, whatever you use, wonderful. one thing I like to say to the improvers in the group is, you know, what is it that we're really after here with the psychology for improvement? What is it that we care most about in this model? And boy, people usually say change or testing or, you know, an aim. And no, I say it's not it. It's the word that everyone takes for granted, and it's the word we. It's the smallest word there. It's the one that we assume exists, and we're not paying enough attention to it. All of these questions, the precursor to them is that there's a group assembled that cares enough to want to spend some time developing an aim and some measures and change ideas that they can test. And so paying exquisite attention to that we is our work and cannot be underestimated in terms of our success for improvement. And as I had noted, many of you I'm sure are familiar with Everett Rogers' diffusion of innovation curve. And so I won't get into the theory here. What I do want to say is, you know, usually we experience that resistance to change. That's the chasm there, where we have the early adopters, they're pumped, take it on, they see the joy and use of what we're trying to get done. It's that early majority where we run into people's pushback. And what I want to encourage us to see is not a mathematical concept. What I want to encourage us to see is how people feel. So when we look at this is what it reflects. It reflects how people feel at different stages of that innovation. And we can all relate to the traditionalists. I mean, I'm certain that in our own experience of COVID, we have ourselves been resistant. We ourselves have been angry. We ourselves have been fearful. And so we understand what it means to resist change, right? And so that's great news for us, because that means we can also empathize with resistors. This is William Bridges' model. He had done he's a change management consultant, he's passed away since, but he basically identified that people's psychology of change is similar to our stages of grief, where we move from denial to resistance to exploration and to commitment. And I invite you to think about your own experience on the past months and how you have gone through this curve. I can even just observe in our international leaders, the denial and shock, the resistance and bargaining, the exploration until they've gotten to a point of commitment. You can see this modeled everywhere through beautiful examples, honestly, of this curve. And our work is to move people as improvers from resistance to exploration, and then ultimately to a point at which they have integrated that change of behavior across the entire system. Here's the good news. Resistance is not a bad thing. It means we're out of the stage of denial, where we can't even see that the change would even matter or affect us, right? At least it means there's a recognition that maybe that change makes sense. We just don't want it. And as improvers, you know, what we're hoping to do is to say, okay, meet that resistance with warmth and empathy and energy, because that's a place to begin to play with how people feel and enable them to identify those feelings as an intervention, so that they can see their own fear. What that means is not getting into a defending stance, not getting into a dueling stance. The idea is when you know this feeling, right? When someone attacks you and you defend, it keeps us in our own place. And there's good neurological evidence that the brain will defend its own story. Instead, we want to do sort of that jujitsu move where we want to hug that fear. We want to get into those sources of resistance and explore them and invite people through co-production methods like appreciative inquiry and motivational interviewing and open and honest questions and deep listening, an opportunity for them to identify those feelings and see it, so that they can also begin to explore how else they could feel or what else they might think could be a place to begin to try something different. And that enables us to move from this mindset of, I want to get everybody to do what I want to do in improvement, to how can I actually get them to do what they want to do? What are the tools and methods that enable me to let them identify that? And that, of course, means we have to be open to being changed, because what they might want might not be exactly the same as what we want. But that means that we also have some psychology of change work to do, and around how we could, connect the dots between what we value and what our interests are in this work. You guys have already mentioned Deming. Many of you come from a discipline of systems thinking, and I appreciated whoever it was that said that psychology is sort of the lens, the forgotten lens. That was the feeling from IHI as well, which is how I had the good fortune and dumb luck to be able to explore this. And of course, Deming was very clear in his work, although he didn't necessarily, in my humble and respectful opinion of Deming's remarkable work, didn't get deep into the existing change management, organizing, design thinking, all the different types of, even back then, the applied methodologies that really enable people to transition and transform around change. And so this provided us, anyway, a good time and opportunity to do that crosswalk and explore, psychology and sociology at sort of a high level, and take on these different disciplines and do sort of a crosswalk and say, what's the commonalities between these different contributors around change as it affects quality improvement? Where is the highest leverage? And what was really cool is we started mapping the tools. We saw a lot of patterns around where there was convergence in the tools that people were using. And that's how we began to identify this framework around activating people's agency at the core of all of these different methods. The agency to act as being the ability of an individual or a group to choose to act with purpose. And that breaks into two drivers, right? One is power, having the ability to act with purpose in the first place. That could be a strategic ability, it could be a very practical ability. And then also courage, so to have the heart. And that's the emotional resources to choose to act. You could have the power and not the motivation or the emotional resources to make that choice. And so you're going to need the head, the heart, and the hands to have the power and courage to move people from resistance into exploration. And that's the level of the self, right? The individual, the group, the team, and then the system. And I want to just note on the system level, the structures and processes and conditions, those are created by people. And so they are created at the level of the self and the interpersonal. And so just noting that we can also change those structures and processes at the levels of the self and individual to affect a system level change. So this is where the framework came out in terms of domains of practice. These are 5 intersecting, overlapping domains in which, playing in one, you find yourself in another. They also, you can kind of start anywhere and go anywhere. And certainly many of you on this, in this group are experts in various domains and could spend even, as we know, an entire lifetime dedicating ourselves to any one part of this. So this is by no means comprehensive, but these 5 domains I'm going to quickly go through, and then I'm going to talk quickly about measures, and then I'm going to kind of leave it there. The first around intrinsic motivation. This is moving from that extrinsic set of drivers, which we often see in our health systems on a compliance-based sort of organizational standpoint, to shift from compliance to commitment, right? If you're activating people's agency, that means they're committing to behaving this way. They're choosing to act. And that means there has to be a source of motivation for that. And we're looking at intrinsic sources of motivation that enable people to come back and sustain that over time. Lots of different practices here. Some high leverage ones for improvers are the use of storytelling and public narrative, which many of you are probably familiar with. Motivational task design, playing, celebrating, helping people tap into their sources of genius and unique skill that they can bring from which they derive great joy. So this is one area to play. Another is in co-design. A recognition in the psychology of change that those most affected by the change, whatever it is, have the greatest interest in designing it in ways that are going to be meaningful and workable to them. And so that means being aware of our own bias, understanding that seeing the system through the people, so mapping the system as a set of actors, and understanding who has an interest in that change, and of course thinking about, instead of just the what and how of improvement, thinking about the who. So whenever we are going to get into some improvement tools, we want to bring the who back in and make sure the people are present, whether that's in your driver diagram or your aim statement or what have you. Another domain is around co-production. I know, you know, the UK sort of leads the way in the world around co-production and co-design. And so this is, you know, very familiar to all of you. I won't go too deeply into this, but really, in my mind, this is the heart of the entire framework. You have to have this domain to make this go. And then the next is around distributing power. So the idea that everybody has something to contribute, and how do we invite and create structures that enable people to bring to bear their unique assets to bring about change, as well as practices that really allow us to distribute power through collective decision-making, reverse mentoring, a variety of practices around creating shared norms and expectations and so on. And then the last is present in all improvement, which is we are adapting in action, and that itself is a motivational experience. Every time we PDSA something, that's an adaptive practice. And so the learning itself can be a motivational experience for people, and it can enable them to become more effective. And there are some practices here around having that emergent mindset and being able to see failure as success in terms of allowing to teach us something that makes us do something better the next time we PDSA it. And of course, coaching being really critical in the work of improvement. So last to cover is just, all right, so what? So we're all improvers, then how do we measure whether these methods are having an impact, right? I mean, we know that we may have an aim in our improvement work. So if you're gonna bring to bear, let's say, storytelling or co-production strategies, so is that improving your ability to achieve your outcome, like Dr. Rose, getting everyone to adopt that checklist? And so we want to see if the use of the psychology of change methods creates improvement. And we can do that by measuring whether we see higher adoption rates or increased sustainability of change. And of course, there's many secondary measures around, for example, increased joint satisfaction of the staff and so on. And I just want to offer, there's no one right way to measure agency. I'm very curious to see what this group might come up with or do or has done already, which is, you know, this idea that we can actually ask people how, if they feel their agency has been activated through the use of the methods that have been brought to bear. And of course, in any of these domains, depending on your change ideas, these methods that you take forward in the psychology of change, you can certainly measure the outcomes of that as well. You certainly don't want to measure too many, and you want to measure what matters to people. So that's what I think is so cool about the psychology of improvement or change, is that you can actually apply any of these domains to the process and practice of measuring itself, right? So you can co-design those measures. You can make measurement fun. You can make data transparent, and so on. So there's sort of a meta level of using this as you measure. And so that's really the framework that we've put together. But again, by no means complete, but hopefully offers us a starting point of some collective ideas and frameworks. I do want to share one other thing really quickly, which has come out of Hamad Medical Center. And they have been playing with this in earnest. They just sent 29 folks to the Psychology of Change program at IHI, and they've been working to begin this. And they turned it into a driver diagram, which I just think is so neat. And so they have taken their change ideas like using storytelling or mapping their actors or conducting one-to-ones with open and honest questions or distributing power through snowflake structures or collective decision-making and so on as their change ideas. And then they are working on then being clear about how they might articulate an aim for the psychology side of their improvement project. Of course, the outcome is really the improvement itself, but this is sort of a set of process measures by which we can understand whether we're enabling people to adopt those changes. I hope that helps in terms of grounding us in a little improvement science. And then the last little thing here on my slide is simply to share a couple things with you, which I'll put this in the chat, but this is a little playlist that has a ton of UK rock on it because, you know, our good friends Helen Bevan and Catherine Pereira and the NHS Horizons have been core to helping us develop and be thought partners with us around the entirety of the framework. And so this is made up internationally. We invite you to play your change anthem. We may need those anthems now more than ever. And certainly, if you haven't checked out our Psychology of Change course, we invite you to, you can still join. I think Freddie has joined, and we also will probably be running this again this fall. What I want to really note is we are testing something new, which I'm so pumped about, which is a UK-led, including the great Anna Burhouse, a UK-led all-learner set of calls by guest experts from the UK who are running it in a more time zone friendly way in your neck of the woods. And so we're getting to hear from your community, leading sort of the global community around the psychology of change. And we're just delighted about that. And thank you, Anna, for your contributions to that. So that was a lot for me. I'm sure that's exhausting you. So we'll just stop there and I'll give you sort of our virtual fist bumps.
Lovely. Kate, thank you so much. That was fantastic. Really, really rich and a really brilliant kind of, foundation for our conversation this afternoon.